Hi, this is Dr. Sylvester, and I'm going to show patients how to do a thing that we call nerve gliding here at the clinic. It's an exercise that we use for all kinds of nerve pathology. A lot of people have neuropathy, and we use it for patients with neuropathy. And we also use it after surgery if they've had tarsal tunnel syndrome. If you have tarsal tunnel syndrome, we use it before surgery to try and get it to go away. Basically, it's stretching the nerve and getting it to glide in its tunnel. So I'm going to have my assistant here move her foot, and we're going to show you where this tarsal tunnel is. I'll draw on her foot if it's okay. I've drawn a couple of dots. The nerve comes down here like this, and then it branches into 3 big branches, and then there's a couple, depending on the individual variability, there's a couple of other branches as well, and then this branch is quite small on the back. But anyway, the nerve there's a tunnel that this nerve gets trapped in, and so I'll draw that in a little different color. There's a little thing up here called the flexor retinaculum, and underneath this is called the tarsal tunnel. And then there's some other tunnels down here that cover the nerve, and the nerve kind of gets pinched there. So one of the things that we do is try to get this nerve to move in this tunnel. So, and you can all see, because I've drawn it, you can see, so you can move the foot all the way in, and the nerve's fairly short. And then you move it all the way out, and the nerve gets very long. So you can see there's a lot of gliding going on inside that foot. And so what happens is that we're trying to get the nerve to loosen up and glide, and thereby decrease the adhesions and things. How we tell our patients to do it is to take the foot up and out all the way, hold it for 30 seconds, and then bring it, and I'm not going to do it for 30 seconds, then bring it down and in and hold it for 30 seconds. And then repeat that about 5 or 6 times, and do that maybe 10 times a day. Up and out, down and in, and do that 5 times, and then do it about 10 times a day. Okay? There's another nerve on this leg, and and it comes down here on the front of the leg and goes down. And you can do that nerve as well, and it's basically the same exercise. You're just stretching the nerves on the front of the leg. And so it's down and in, and then you stretch it and hold it for 30 seconds, and then up and out. The symptoms that can go along with this nerve pain are, when it's on the top of the leg, you can have numbness, tingling, burning, electrical sensation on the top of your foot in this area. On the bottom of your foot, when you have that, it can come as heel pain, it can come as arch pain, it can come as just, nighttime burning, tingling, all the symptoms that people associate with neuropathy. So anyway, that's a nerve exercise you can do, and if you do it frequently, a lot of times it can alleviate a lot of the pain that you have in your leg. We use it all the time right after surgery to keep the nerve moving so the scar doesn't heal down on the nerve. Thanks for listening.